Here is a sweep of the room. We don't have any notes out. None of that. Okay. So, upon entering a patient's room, I would provide for patient privacy. I would perform hand hygiene in front of the patient so she can see that I was performing hand hygiene. And I would start talking with my patient. Hello.
Hi.
My name's Taylor. I'll be your nurse today. Could I take a look at your wristbands? Could you tell me your name and date of birth?
Josie Ferniehill, 31694.
Beautiful. How are you feeling today, Josie?
Feeling great?
Are you in a good mood?
Yes.
Okay. Why are we here today?
A wellness checkup.
Nice. Do you have any complaints or concerns to go over?
Not that I know.
Okay. Then we will start our assessment. We're just going to do a quick general assessment and then we'll go into a cardiac assessment today. Let me know at any time if you are in any discomfort or want to stop.
Okay.
So my patient appears to be a 20-year-old white female, as she stated before. When looking at facial features, the client's face appears to be symmetrical, no abnormalities or lesions. Patient is appropriately dressed for her age and for the cold weather. The patient appears to be clean and in good hygiene and appears to take good care of herself. Client is medium build, appears to be a healthy weight for her height and build. When observing the extremities, I do not see or notice any visible lesions or deformities. When asked about her mood, the patient stated that she was in a good mood and felt good, which matches with her facial expressions and her body language. Upon talking to me, the patient speaks very clearly and seems to be coherent and understanding of what I am saying. When entering the room, the patient was alert and seemed to be sitting upright and comfortable. So now we will move on to your cardiac assessment. How does that sound?
Great.
Okay, so I would start the cardiac assessment by collecting my subjective data by asking just a few questions. Do you have any chest pain or tightness?
Do not.
Do you have any shortness of breath?
No.
How many pillows do you sleep with at night?
1.
Do you have a cough?
Nope.
Have you had any recent weight gain?
I have not.
Do you have any swelling in the ankles or feet?
No.
Do you wake up in the middle of the night to urinate?
No.
Do you have any history of health problems?
No.
Or heart problems?
No.
No. Do you have any family history of heart problems?
I do not.
No. Okay. Well, then we will start with the objective data. And I would first start by palpating all 5 of the cardiac areas, starting with the aortic. So I would find the sternum, the aortic cardiac area located in the right second intercostal. And then moving to the pulmonic, which is in the left second intercostal. And then moving on to the herbs, which is in the third left intercostal. The tricuspid area, which is the fourth left intercostal. And then moving to the mitral cardiac area, which is going to be in the fifth intercostal down the midclavicular line. So I would find the center of her clavicle, follow it down, and feel for her mitral cardiac area. And upon assessing your 5 cardiac areas, I did not find any significant signs of lifts, heaves, impulsations, or thrills. So after assessing those 5 cardiac areas, I would palpate the apical pulse, which is also in the left fifth intercostal down the midclavicular line. And I would be feeling for the size and intensity. The apical pulse feels to be a regular 1 to 2 centimeters in size. There was a short, gentle tap and did not show any signs to be diminished or accelerated, so it seemed to be very healthy. So now I would move on to the auscultation using the bell and the diaphragm. So I will start by using the bell, starting at the apical pulse, or aortic, the aortic pulse. Going to the pulmonic and the herbs, tricuspid, and the mitral down the midclavicular line. And then I would move on to my diaphragm, going back to the aortic, to the pulmonic, down to the herbs, to the tricuspid, and to the mitral. Okay, and after auscultating all of these areas, I would measure the patient's apical pulse for a full 60 seconds. Okay, after measuring the patient's heart rate for a full 60 seconds, it found to be a healthy heart rate of 74 at rest. So that would finish my cardiac assessment. Ta-da.